This is a good time to talk about phonetics. What happens when you change the length of somebody's anterior teeth? Is that dangerous? I mean, could you give them a lisp? What's going to happen? I equate it to a golf swing or a golf grip. If you've had this homemade swing or this homemade grip, and now you get with a pro and he says, turn your hands to the right a little bit, keep your right elbow in, stay connected, it's going to feel weird with capital letters for a while. Same with changing the front part of the mouth. That's the reed in the woodwind instrument. And so when you say the sounds, write this down, F, S, V, church, swish, those sounds will be effective. Now, like the golf swing or the golf grip that's improved, they're going to be perfect. The patient is going to love it after a day and a half. When the patient leaves your office in the provisional restorations, they're going to go home and read aloud out of a book for about 15-30 minutes for the first day or two, so that they learn the new position of the teeth and can enunciate the F, S, V, church, swish. Those are the sounds. Why F and V? When you say F, the incisal edge of the central incisors contacts the vermilion border of the lower lip at the end of the sound. F. When you say V, the incisal edge of the central incisors contacts the vermilion border of the lower lip at the beginning of the sound. V. So what I tell these patients, if I lengthened her teeth just a bit, said you're going to feel like you have horse teeth for the first day and a half, because that incisal edge is going to contact the vermilion border of the lower lip sooner than it did when your teeth were short. Now, after a day and a half, it's going to feel natural and it's going to feel good, and you're going to adapt to it because you are going to look so good. Same thing with S, swish, church. When you say those S sounds, air is passing between the incisal edges of the mandibular and maxillary anterior teeth. That's why I like a flat line or flat incisal plane on the lower central incisors, with the cuspids being a little bit longer, and that matches perfectly with the U of the maxillary incisal plane, which is parallel to the lower lip. That creates a surface that's perfect for saying S, swish, church, and they will adapt. Why? Because it looks so good. This person is not going to have to adapt with their tongue and their lip. They just get used to making those sounds. If somebody has a weird and presenting incisal plane, they may have had to say S like this. S, so they don't lisp. If a patient, like a lady I saw the other day that had her upper teeth veneered, and they created a reverse incisal plane, well, she lisp like crazy because she can't capture the air in a tight space between the maxillary and mandibular anterior teeth. With that reverse curve, there's too much space between the maxillary and mandibular anterior teeth, and that's what makes you lisp. If you can create a tight space, which you can every time with the incisal plane that we've talked about of the maxillary and mandibular anterior teeth, and there was a U paralleling the lower lip, in which the centrals are the longest teeth for the maxillary incisal plane, and a flat line across the incisors of the lower anterior teeth for the mandibular incisor plane, with the cuspids being a little bit longer. That creates the perfect reed for this woodwind instrument. I've never had a patient in 36 years of practice that did not adapt perfectly to the new tooth position, because it's perfect for their face, vertical dimension, and lip position. The nice thing about testing it in the provisional restorations is if you ever did have somebody that just mentally couldn't adapt to it, you could change it back. But as I said, I've never had that happen, and I don't think you will either. And that's the Dental Minute.
Hey guys, I hope you enjoyed this episode of the Dental Minute. If you have not pressed subscribe, do it right now. because next week we are going to talk about, is a veneer stronger than a natural tooth? You will not want to miss that episode. We'll see you then.